This video focuses on the main causes of miscarriage. As you watch this video, please write down any questions you may have so that you can share these with your provider. Miscarriage is the unexpected loss of a pregnancy before 20 weeks of gestation. Nearly 25% of Canadian women will experience a miscarriage in their lifetime. Miscarriage often occurs in the first few weeks of pregnancy. Although a common part of human reproduction, when miscarriage happens to you, it can be heartbreaking and devastating. You may worry that something is wrong with your body, or that you did something to cause the miscarriage. It is important for you to know that miscarriage is not your fault. Routine activities such as exercise, having sex, travel, and work do not cause miscarriage. Some miscarriages happen abruptly. You may feel cramps, see blood clots, and pass tissue. Others may happen without symptoms. You may not be aware that anything is wrong until your first ultrasound appointment. No matter how it happens, you may experience intense feelings of grief, anger, or sadness. Or you may feel numb at first, but go on to experience a range of emotions later. Everyone's experience is unique. The cause of miscarriage is not always known. However, studies have shown that over 70% of miscarriages are caused by random genetic errors that occur before or during the development of the embryo. The most common of these is called aneuploidy. Aneuploidy happens at the cell level before a pregnancy has even occurred. Human cells generally carry 46 chromosomes. If there is one chromosome too many or too few, the cell is aneuploid. Before an egg cell and sperm cell unite to become an embryo, they have to divide their chromosomes perfectly in two in order to donate 23 chromosomes each, or half their DNA, to the making of the embryo. This process of dividing is called meiosis. When chromosome pairs don't divide perfectly, the resulting embryo may inherit more than 46 chromosomes, or fewer than 46. And as a result, the embryo may not have the essential genetic material needed to survive. It is also possible for a newly created embryo to have the correct number of chromosomes, but have too much or too little genetic material, or DNA, carried on these chromosomes. An embryo with this type of genetic imbalance may survive long enough that you can see it on your first ultrasound, but often it will have stopped growing before this. Most often, the embryo stops growing at some point in the first trimester up to 12 weeks. Aneuploidy is very common. It isn't caused by anything you have done, and it cannot be prevented. But we do know that as we age, it occurs more frequently. For example, research shows that the risk of having an embryo with an extra chromosome, called a trisomic pregnancy, is 2 to 3% for women in their 20s, but rises to 30 to 50% for women over 40. If you live in BC, you may be eligible to have your pregnancy tissue tested at the time of miscarriage to determine if aneuploidy was the cause. Talk to your provider about testing if you have experienced 2 miscarriages in a row, or if you miscarry after 10 weeks based on ultrasound size, or if you are 35 or older at the time of your miscarriage. Most of the time, a miscarriage caused by aneuploidy or another genetic imbalance is followed by a healthy pregnancy. Although much less common, miscarriage is sometimes caused by other medical problems, such as diabetes or thyroid disease, problems with the uterus, autoimmune conditions such as lupus or antiphospholipid syndrome, genetic variations in the parents. These medical conditions are often associated with recurrent pregnancy loss. Your provider can help you determine whether you should be tested for any of these conditions. Regardless of how common miscarriage is, it can feel like a significant setback in your dream of having a child. It is normal to feel grief after a miscarriage. You may feel isolated and alone, but you are not alone. There are countless parents and families experiencing the same loss. When you are ready, reach out to those you trust and share your feelings. Reach out to your provider. Look for resources online and support groups in your area. Getting support from others who have experienced miscarriage can be very healing. For more information about miscarriage and for a list of resources and support in British Columbia, please visit www.bcwomens.ca and search for miscarriage.